Public health emergencies take many forms: disease outbreaks, acts of terrorism, natural disasters. Because we never know when they may strike or where we may be when they do, it's critical that we be prepared. Preparedness begins at home. As a healthcare agency responder, the safety and welfare of you and your family is the primary focus during an emergency.
So guys, you remember that because of my job with the county, if there's ever a major emergency, that there's a good chance I'll have to stay.
Make sure that your family understands your role as a healthcare agency responder and that you may be required to report to or stay at work in a declared emergency. You should have a household emergency plan and know how you will get in contact with each other or where you'll meet in the event of an emergency.
Get in touch with each other.
Build an emergency supply kit containing at least 3 days of water and non-perishable food, as well as other emergency supplies. A smaller version of this kit should also be kept in your vehicle and should contain a change of comfortable clothes. Our objective is to effectively coordinate response activities while protecting the community and residents of Orange County. These activities include ensuring that the healthcare system in Orange County is supported and operational, and that life-saving medications, vaccines, or medical supplies are distributed to areas within the county where they are needed most. The healthcare agency has developed a three-pronged approach to ensure these objectives are met. The ability to coordinate all healthcare agency response activities and quickly modify and adapt them to changing conditions. The ability to quickly supply any area of the county's 800 square miles with these critical materials. The ability to reach at a local level large masses of the public in a continuous and efficient manner to dispense critical health-related materials. In order to effectively monitor public health emergencies, the healthcare agency has established the Health Emergency Operations Center, or HEOC. From this centralized and secure location, agency staff coordinates HCA and field response efforts. Tied directly to the county's Emergency Operations Center, the HEOC monitors field and HCA program activities and tracks the movement of health-related supplies through the local distribution center and out to the various field response sites and other locations. The HEOC is fully scalable to the extent and nature of the response and will remain operational throughout the course of the response efforts. The healthcare agency has established a centrally located facility to serve as a distribution hub to receive, store, and ship the large volume of pharmaceuticals, antidotes, and medical supplies needed in a public health emergency. The county's local distribution center, or LDC, is a fully equipped medical supply warehouse. Always in a state of readiness, in the event of a public health emergency, the LDC will operate around the clock to receive essential medical and health supplies. It will in turn distribute these supplies to field response sites, hospitals, and other response locations and partners. Your role will be to assist in the smooth flow of supplies into and out of the LDC. You will most likely perform a variety of duties within the LDC, such as receiving and stocking supplies, preparing items for shipment, inspecting outbound shipments, or coordinating deliveries. The healthcare agency, working with local communities, will establish point-of-dispensing sites, or pods, to efficiently distribute critical medical items to the Orange County public during a health emergency. Pods are a proven method of dispensing to large groups of people in a short period of time essential life-saving materials. Nearly 80 locations throughout the county have been designated as pod sites. In Orange County, due to our reliance upon the automobile, every pod site will include both a walk-through and a drive-through model to dispense medications or vaccines. Your role at a pod site may vary, but will more than likely involve supervising one of the 4 critical stages of pod activity: the check-in, screening, dispensing, and exit of visitors to the pod. The more people we move through the pod process in the shortest amount of time, the more lives we save. It's important that you prepare now by better understanding how a pod works, the various positions and their duties within the pod, and the HCA objectives when establishing a pod response.
They're going to be strategically placed in and throughout.
Once the need to establish and activate response actions has been determined, you will be notified of your assignment, along with when and where to report. Arrive early, before your scheduled shift, and be sure to bring your employee or volunteer identification badge. Each location will have a designated staff parking and registration area. Once you have signed in at the staff registration area, you will receive your position assignment, your response vest, a position checklist, and any other information that is critical to your position. You may also receive a communication device, such as a radio, along with instruction in its use.
Push to talk. It's only going to hear you when you're talking.
Briefings are our primary method of communication during an emergency response. A briefing will be provided to you by your supervisor to outline your duties, review your assignment, and answer any questions you may have. Remember that for any issues or questions that may arise, your supervisor is there to provide guidance and assistance. As an HCA responder, you may be requested to fill a supervisory role. Please view the management video for supervisors for helpful information. Your shift may last up to 12 hours. During that time, breaks along with food and water will be provided. Be sure to bring any special dietary foods or prescription medications you may require during your shift. At the end of your shift, update your replacement to the current status of activities. Alert them to any issues and transfer your vest and any equipment you may have. Verify your next work schedule and debrief your supervisor. A number of online, print, and video tools are available for you to gain a better understanding of the healthcare agency's response efforts during a public health emergency. Additionally, each year, a series of training exercises are conducted to provide a hands-on opportunity for HCA staff, volunteers, and community leaders to better prepare by simulating an actual emergency. When participating in these exercises, we encourage you to give it your full involvement. The better we prepare now, the better we'll respond in the future. This preparation includes those efforts we take at a personal level, as well as those we take as part of our role as HCA response staff. Your preparations should start immediately.